All right, this is a case of a 70-year-old patient. Let's have a look at this sagittal T2 weighted MRI of the distal thoracic and the lumbar spine. Okay, we're going to focus on some very specific findings. So let's look at these lesions that are seen in the mid to posterior aspect of the multiple vertebral end plates. As you can see, all the discs are in general of low signal in T2. The normal distinction between the dark annulus fibrosus and the bright nucleus pulposus inside is completely lost in most of the discs. A little bit of fluid signal is seen in some of these discs, but in general, most of them appear to be a bit dehydrated. All right, and it's quite obvious at the multiple levels there is disc space narrowing and herniations of the discs, but we're going to focus on these patterns of herniations which is happening into the vertebral end plate, which is called a Schmorl node. All right, so let's look at some of the key features of Schmorl nodes. So Schmorl nodes are herniation of nucleus pulposus of the disc into adjacent vertebral end plate. It is commonly seen in the T10 to L1 area, the area that is mostly affected with stress in the spine. This site of involvement in the end plate is usually central or towards the posterior axis of the vertebra. It's commonly associated with Sherman disease and chondroplasias like multiple epiphyseal dysplasia. So quite often we do see these findings, and in many of these cases it is not symptomatic, but is it one of the causes of disc degeneration? No, it is not. There is no clear-cut theories on why these things occur, but there is definitely a genetic component to people with small nodes are usually having a genetic predilection for disc degeneration. So watch out for these lesions, and let's just go back to the case so that you can actually see uh, yeah uh, how the involvement is predominantly and prominently in the lower thoracic and the upper lumbar vertebrae, that is the thoracolumbar junction. To a much lesser extent you can see it in the lower lumbar end plates.